All. This is Dr. Mobeen Sayed from drbeen.com. This is the second show for today. Welcome. And we are going to have a chit chat today. So, how's everyone? Quick update on me. Today, I did not take Allegra as well. Yes, I think Allegra I took yesterday. So, no Allegra, no other supplements, no anti-inflammatory, no ivermectin. Now, the second day, no ivermectin, and I am 100%. So no tiredness, no fatigue. Even interestingly, my oxygen saturation has been registering at 99 today. I had thought that I am at 98. But today, the whole day, I kept checking 99. So once again, was it COVID, not COVID, whatever it was, eventually that is where I am at this time. So welcome everyone. Let's continue with our discussion for the previous discussion. What do you think about the CD147 based theory? And here is a question from Patricia. But the virus is minuscule compared to the RBC, correct? So it is just a tiny glue. If it can bind with 147 and it can bind with another 147 and kind of put them together, then RBCs can actually clump with each other by themselves. RBCs can then clump with platelets as well. So viruses has to kind of bring them together and then they start clumping together as well. Anna says, so happy and well. Thank you very much. Splat Hub says, tinnitus and neuropathy caused by COVID, any medication that can help? Already tried ivermectin, fluvoxamine. So Dr. Drew said that, so he had developed tinnitus as well because of COVID. He said, as soon as I take fluvoxamine, it magically, my tinnitus disappears. And then he says, I feel much better. So again, and please, fluvoxamine over the counter can be very scary because it can cause suicidal thoughts because it changes the person's mood, usually towards balancing towards normal, but it can cause suicidal thoughts as well. So please do take it with doctor's advice and their supervision. Jody saying, guys, remember to like. Absolutely. Thank you very much, Jody. Pasi, bonjour to Pasi as well, and bonjour to France as well. Siddhartha, how are you? DDS says, question, someone said that theory was debunked. The theory would be debunked if the 147 binding is not possible. And I'm seeing some other studies as well that are showing that binding. But I think this theory didn't get enough traction, though. So I'll do some more digging up. Yeah, so I am seeing some newer researches as well, John. Carol says, can 147 bind with vaccine-produced spike proteins? So I have done a discussion very much in detail. The vaccine-produced spike proteins are not allowed to get out of the cell willy-nilly and get out and roam around and go and attach with RBCs because they are, number one, formed inside the cells, and number two, presented. They're formed in the cell and then they're shredded in the cell and they're presented on the cell surface. The only time they can actually spill out of a cell is when the cell that is making them is broken by our immune system. But if that happens, this is like immune system cell comes and pops a balloon. And if there is confetti inside the balloon, that is going to kind of pop out. But the immune system cells that are sitting around, they are going to eat that debris and the confetti and the spike proteins. So spike proteins are not going to get a chance to go into RBC blood and do those kind of things. In theory, if you said, hey, we want to find, due to some mechanism, spike proteins are produced and sent into blood, let's say theoretically, then yes, they can attach with the RBCs, but they cannot really cause clumping because, for example, if I have two hands, now I can bind one RBC with one hand and the other RBC with the other and kind of clump them together. But if these hands are free floating, then one hand can attach to an RBC and just float away with it. The other hand can attach to another RBC and float away with that, and they're not going to clump. So for clumping, you need a centralized body that is attached with those hands and pull the things that hand has bound to together. So what is the confusion? Emily says, I'm confused too. What is the confusion? So Emily says, does the clumping eventually resolve, or is it something that long haulers are still dealing with? So Emily, RBCs live only for a few days, right? 90 days, 60 days. And then once an RBC has become clumped, the white blood cells are going to come in and break them down and clear them up. So this clumping will be cleared out. However, before a clump is gone, sometimes the clump has a snowball effect and it keeps becoming bigger by collecting more and more cells in it. And then it goes downstream and gets stuck in some blood vessel that may cause damage to the tissue, which may be reversible or irreversible. So it is the temporary damage, which may be permanent then, and the temporary occlusion of the blood flow, which may cause severe outcomes for the patient in that stage. Eventually, clumps have to resolve. Otherwise, patient would die. Dr. Bean did a recent video noting physicians were progressive. Yes. John Snyder is looking at the likes. Thank you very much. So tubersterini, fluvoxamine and ivermectin do not have overlapping mechanisms. Ivermectin's mechanism is outside of the brain, working with the, as you can see, inflammation and virus blocking. Fluvoxamine's function is mostly inside the brain, working with serotonin, and so they are separate. Janna saying, yes, this is what happened to me. I hope, Janna, you're feeling better. Janna, yes, very correct. Individual immune system. Everybody's immune system is responding differently. Absolutely correct. So where to find ivermectin? Correct. So there are many, including FLCCC. I also did a video about the doctors who are prescribing ivermectin. Miraj says, I had my COVID vaccine shot yesterday in Peshawar. My friend was of the view that I should have waited for AstraZeneca, which will be available in a week. Time needs your comments. You have the shot. It is fine. I am assuming you had Sinopharm, and Sinopharm is fine as well. Carolyn says, mine is extremely high pitched. I can't stand silence because of it. Oh, I'm so sorry about that. So is this because of COVID or just in general you had it throughout? Janna says, just to follow up, not well today, but yesterday was a really good day. Just took my ivermectin as it's Wednesday, fighting a cold again. So depressing. Question, scared to stop my ivermectin, but confused. So Janna, number one, I'm so sorry. I hope that you recover fully and soon. I usually try not to give direct advice, but let me ask you this. Have you tried steroid, number one? And number two, have you tried weekly full dose of ivermectin instead of this divided doses? Tell me, I think it is great that you have ivermectin. I think the dosage is not proper. Saper Steve says, won't taking a baby aspirin daily prevent COVID or at least protect against developing severe symptoms? It is one part of protection, yes. Prevention, no, but protection, yes. Westfield says, upper limit for who can get the vaccine. It is not the age. It is their body's situation. For example, if a patient develops diarrhea or nausea or other fatigue and such symptoms, regardless of their age, is their body able to handle it or not? That is the most important question. Francis 71 likes Luffy is not happy. Yes. Bambi says if a patient gets a pulmonary embolism 2 months after COVID 19, is it possible that they could survive with hospital treatment, or is death most likely? Asking in context of an immobile patient with MG. It depends what kind of embolism is it. Most of the pulmonary embolism are very well tolerated because our lungs are big, uh, um, fluffy things. And so if one part has an embolism and a tiny part of the lung is damaged, so what? It is really larger portions of the lungs. For example, saddle embolism in the lung can kill the patient on the spot. Then smaller embolism that take a significant part out or cause severe hemorrhage can be dangerous, but otherwise they can be resolved and patient can survive. Oh, so sorry to hear that, Janna. Janna, steroids and full dose ivermectin is what I think is the right way. Yeah, so why 3 milligram per day, even three times a week, does not make sense to me. Um, Zakir Khan says that ivermectin remains in blood for 3 or 4 days, then the role of prophylaxis weekly or twice weekly is useless. Is it? So interestingly, this has never been used like this. So prophylaxis studies that came out of, let's say, Egypt or other India, they had used ivermectin twice in a month and still had 75% better outcome than the placebo. So there is still something in ivermectin that can go on for a longer period of time. Many of the studies that have used ivermectin also used ivermectin twice, and that's it. I, on the other hand, have been using it weekly. Again, if I uh, look at the distribution and kinetics of it, that half life is now, let's say, 3 days, then it should be taken every 3 days at least, and full dose, not half or one third of it. So there is a question about bad headache with long haulers. I had done a talk about the headaches and brain fog or myalgia and the neck massages and those. Please watch that video. At least do neck massages. At least do your neck pumps. These lumbar spinal cord pumps. So moving spinal cord like this or like this, which allows the CSF to move, and that also helps. Many patients have sent me messages saying the neck massages and the cervical neck pumping and the other lumbar spinal cord pumping has really helped them. And Gregory says gua sha is good for neck massage. Awesome. um, Emily, okay, so I'll do whatever, just hard whenever I'm on my own. Yeah, full dose, Jana. So Jenna has a question. I have had several rounds of steroids and IV. I know ivermectin. I hope that by IV you mean ivermectin. I know ivermectin helped, but now fighting third cold, but only second since being on ivermectin. I'm on week 5, 3 milligram Monday, Wednesday, and Friday. So if I am in this stage, what I will do is I will take full dose every 3 days in the light of the current distribution, or every week, full dose. I would combine one low dose steroid therapy. Again, I do not know that the steroid round that you say you've taken, what was the dose and how long. I would take one 6 days steroid therapy with ivermectin every third day, and then go on like this for about a month and see what is the response. Because I cannot understand why, even with ivermectin, while you are responding as well, the cycle is continuing. So to me, it just tells me that the proper dosage is not used. So Jenna, full dose is 0.15 milligram, yes, 0.15 milligram per kilogram or 0.2 milligram per kilogram. So for a person, let's say somebody is 70 kilogram. So I have done this math once before. I'm going to do it once again today, just so that we are on the same page. This math is really important. So let's say here, if I can take, and anyone who wants to calculate the dose for them, you can probably take a pen and paper and use this part of the video. So let's say your weight in pounds, 160 pounds to kg. That is 72.5. So now we have the person's weight is 73 kg. The lower limit for the therapeutic dose is 150 microgram per kilogram, which is also equal to 0.15 milligram per kilogram of body weight. And upper limit is 200 microgram per kilogram, which is also equal to 0.2 milligram per kilogram. And again, if you look at FLCCC, they actually believe 300. So that is 300 microgram per kilogram. And if you look at the paper today, they are saying 500 microgram per kilogram. So let's stay within the therapeutic range. Now take this weight and then multiply it. I use this one, but you can use this as well very safely. So 73 multiplied by 0.2 equals, so 2 and 3 is 6, and 100, and so 100 or 15.6 milligram. Now the tablets in the US are 3 milligram tablets. So that means about 5 tablets is 15 milligram. That is one dose, one full dose. So that one full dose weekly or one full dose 3 times, according to the study that we saw, paper that we saw today. This is to keep 0.2 milligram. In international, in other countries, ivermectin is also available in 6 milligram tablets. So one can take, for example, 2 6 milligram to make 12, or you can actually break it in half as well if you wanted. Or if you have taken, let's say, 3 times, that is 18 milligram, usually that is fine as well. But I stay within the therapeutic ranges. That is the way. Sorry, there was the comment on it as well. That is the way to do this. So Janna, from the study today, they are of this opinion that ivermectin should be taken one full dose every 3 days, because half-life is 3 days according to the study. I have my usage with my patient has been once a week, and during active infection, just like my own, every day full dose. So you saw that for 6 or 7 days, I had taken 12 milligram every day. And so here I am, according to some folks who have placed their comments on the YouTube that I may have a brain damage, but barring that, I am fine. Okay, so continuing on. So yes, Janna, this is the important thing, that if the dose is not in the right amount, then ivermectin is really not doing anything. So Samantha says long haulers 3 times a week. According to this study, every 3rd day. I give every once a week. Jan says, Dr. Bean, Jan is saying that your brain is as fine as ever. Absolutely. Thank you very much. Boooshes says, shouldn't we have microscopy of RBC, CD147, C19 clumping from current patients? Yes. So they actually, in this paper, they have offered certain theories to be done or certain studies to be done, in which they have proposed that, hey, why not we should look at patient, give ivermectin and see what happens, then take their blood and see if the clumping can be resolved with ivermectin. So Hassan says, I have taken COVID vaccine. Now I feel very bad, headache and nausea. Hassan, usually it just takes a couple of days, 2, 3 days, and it resolves. Simple Steve says, hit the like button. Yes, hit the like button and the bell. Smash the bell as well. Um, Peter says, Mike Osterholm, Hurricane Mike says, we are just about to get crushed. Thoughts? Um, Peter, crushed in what way? Good. Um, so Splat Hub says numbness and tingling in hands, sometimes in my feet too, mostly on my fingertips. This is also, there are two possibilities for this, the numbness and tingling that happens. There are two ways. One is the nerves, and the other one is the nerve endings. It could be in the brain tissue as well, which I include in the nerves. So the most probable with COVID, if you had not developed COVID toes or you had not developed those things, then most probable it is the neurological symptom, and that should reduce with the neck massages, with the pumping of the spinal cord, and with things like fluvoxamine. But again, please, with your doctor's advice, that can have severely bad effects. Ivermectin for the outside can also be helpful. Steroids can also be helpful for outside. So for me, I would be the way I look at my patients. Fortunately, my patients do not become long haulers. But what I feel is that try steroid 1 week, ivermectin another week, full dose, not smaller doses, which are kind of useless, and you're still thinking I'm taking it, and then fluvoxamine, and see which one helps. That would identify where the problem is. Peter says, he says that the new variant is taking over and will create the next massive wave. So SARS-CoV-3, for example. There are many articles I'm reading as well that are saying that, hey, we are going to have the SARS-CoV-3 and SARS-CoV-4, and we're going to have the wave again. To me, here is how I think about it. So let me give you both sides of it when I am thinking. If you think about Manaus region, I believe in Brazil, they were sort of reaching the herd immunity. And then all of a sudden, infection started again. And that was the new variant. If that happens to the world, then it is possible that the same thing happens again to everyone, and we have SARS-CoV-3. So that is the scary side. South Africa is in a similar thing, that the vaccines are less effective. That means the virus has changed enough that our immune system or the vaccine are not able to handle it. On the other hand, on the positive side, I want to show you this. So if you see here, Worldometer, for example, let's start from United States, US. And US has a lots of variants as well. Look at this. Yes, we have not flattened out to the minimum, but we have reached very near that. So this is happening with the variants. And I am aware that there is a news today that said that UK has once again declared that the variant was 30% more, 100% more lethal. They said in the patients who had previous wild type of SARS-CoV-2 versus who had the new variants, there were 100% more deaths in the new variants. So I'm aware of this, that UK for the second time is saying that our data says that the lethality has increased. Here is the number of new cases. Now, there are two ways to look at it. One way is that the virus is actually becoming so adapted to us that it is causing issues and people are not going to hospitals. Imagine for a second, the issue that I had for last 1 week was SARS-CoV-2. I did not need, I was fully functional. You saw that. Yes, I was taking ivermectin, but still I was functional. And many of the doctors who are from California, when they heard my symptoms, they said, yeah, we are seeing more and more such symptoms. So maybe the new variants are actually more adapted. If that is the case, people are not going to go to hospitals. So yes, they're getting infected, but they're not telling the hospitals, so the numbers are not going up and herd immunity is developing. That is one way to see it. The other way to see this is that they're becoming so severely ill that they are really not, all of them are not big cases, and everybody is now at home and they are masking and they're distancing because people are just dying. But I don't see that happening, at least not in the US. I actually, today, when I went for coffee, they had opened up the Starbucks, and previously they would only allow one person to come in at one time. Now, today, they had just removed the counters, went back, and there were more than many people inside. That is because of this. Then if you see the deaths, they are also going downwards. So looking at the data, even in the presence of variants, it does not look like we are in trouble. So let's look at other countries as well. Maybe which country should we look at? Let's say, let's look at Brazil. Brazil new cases, look, this is not good. And they are going up again. Deaths are going up again as well. So Brazil is not showing good outcome. If we go to, let's say, countries that are, let's look at UK. UK has a new strain as well. And UK is the bad case though, because they do not support their patients early on. So look at this. Why is this? Are they not reporting it? Or they really are all sitting at home? There is a severe lockdown. Nobody's out, masks, social distancing. I do not know. Maybe we should look at live camera for UK. Live camera for UK. Maybe London or something. Live cam in the UK. So if I go here, so this is nighttime over there. So not much help. So this is what's happening. So kind of deserted at this time because probably night. So we can see how UK is actually doing in a daytime. But look at this. This is really low. And look at this, active cases going down. So either Brits are totally scared and they're all sitting at home. They're not getting out. There is no more, cases that are occurring, or the newer strains are actually less lethal. Look at the deaths, and this is great. Look at this. If I turn on the 3 days or 7 days averages, look at this, 162. Look at the peak, 1,576 deaths on average, and here 162. So again, I'm not trying to minimize it, but I am also concerned about the fear mongering. I am seeing this so often that people just want us all to be scared and running around like the chickens with the head cut off, and I just don't like it. So maybe I have my own bias of not scaring us. Let's look at, where should we look? Brazil. How about South Africa? Let's look at South Africa because they have a variant as well. What? So look at the numbers. What happened? Is it that they became so scared that they are now all inside and they're saying, you know what, we're not going out. Forget about it. Their peak was 21,000 or 22,000 cases in one day versus 1,400. And look at the active cases. Look at this. I'm sorry, you may think that I'm just talking to myself, but this is how I feel. Look at the number of deaths that are reduced as well. So we have to kind of have these messages from those who are trying to get us extra caution, and we should balance that with data as well. We have herd immunity developing in terms of people getting infected and recovering. We have herd immunity developing with the vaccines. We also have herd immunity developing with the, I believe, this is my part, with the new variants that are zipping through the society without making people too sick, and people are recovering. Correct. Israel, let's look at Israel as well. So, from having Dr. Ileana Aaron, what scared me from her talk was that the virus, once it has stopped infecting more adults after vaccines, it has started turning towards youngsters and is causing infections in them. That is what scared me. But I do not have much data from other places. So, let's look at Israel. So total cases are, of course, continuing. Their new cases are still not down. This always surprises me. And as you heard from Dr. Ileana Aaron, that this is probably because of the multiple things. Number one, those new variants, and that is what started this discussion, that are the new variants going to become SARS-CoV-3 and SARS-CoV-4? Then we would never come out of this unless we shut down the whole world for 2 months. Nobody out, nobody in, done at home, and store your food for 2 months and all go in and don't come out for the next 2 months. Then the virus would die. If that is not the case, so here, newer variants or more children affected or people refusing to have vaccines, if that is the group who is the target at this time of the virus, then okay, it makes sense. Otherwise, it does not make sense to me that so much of the population is vaccinated and we still have these cases. And number of deaths are definitely going down, but still not where I would have wanted these to be here, just like 3 deaths or even 0. So they are still 17, 18, peak is 79. So for a smaller population, this is still significant, but trend is downwards. Not, I would have loved this to be flattened. Pasi says, lol, Michelle. So Pasi, good to hear that you are here and you are happy. Peru. So let's look at Peru. Am I pronouncing it correctly now instead of Peru? Okay. Let's see. Peru. I may have to. Here. So Peru. Oh, wow. Look at this. This is not good. So this is since December, and they are once again almost the 3rd wave. Active cases are generally low, which is a good thing, but the daily new cases are more. So 7,000 daily cases. In the previous wave, 7,000 daily cases, 9,000. So it is a similar wave since December. And if it is really true that it was the president of Peru, the new president, who actually stopped or restricted ivermectin, and then this happened, then this is really bad. Many of the cool beans from Peru sent me a message saying, it's not about the president. We actually can still go get it over the counter, and people are trying to get it, but it does not work. So there are 2 opinions. I do not know which one is correct. Or maybe they both are correct. I don't think they both can be correct. Number of deaths is reduced, but still high. So Peru is not doing good. I am really not happy for this. And if it is the president who did it, he should just reverse his message and allow people to have ivermectin. What about Italy? Simple, Steve. So let's see. This page gets stuck if you go back and forth a few times. Close this one. Worldometer. Okay, so that tab is hung now. Okay. Oh wow. This is not very nice. So here they had the first one, then probably they went in lockdown, then they came out and they had this, and now they are developing higher cases once more. Do they have variants as well? This to me seems like if they don't have variants, then this is seems like carelessness. See, they were actually down and now they're increasing again. And deaths are following. I cannot imagine. What is the Italy's vaccination? Vaccine tracker, New York Times. Let's see. So there was a global vaccine tracker as well. Fully vaccinated. Global vaccine tracker. COVID. Come on. Google comes in and says, I can tell you. Vaccination. Our World in Data. New York Times. Bloomberg has that thing in front of them. They have put a wall. So if you just wait for a second, it's going to appear. So I wanted to see what is the Italy's vaccination. There it is. But it is not doing good. So back here, France says Europe aside from UK not vaccinating as quickly is my understanding. Europe aside from UK. Okay, so the Italy and those countries are probably because they're behind on vaccine. That is what I was trying to see, that vaccine tracker. So how about if I just say Italy vaccine progress? So Statista is, oh, come on, stop, please. Sorry. I hate pop-ups. Number of COVID-19 vaccine doses administered in Italy as of March 10. So can I have the total somewhere? So there had been almost 5.8 million COVID-19 vaccine doses administered in Italy. Breaking down this figure by region is above. Now the question is it 2 doses or one? Just around 1.7 million people in Italy can be said to be fully. So only 1.7 million are fully vaccinated. And Italy's population, 50 million. Italy population, 60 million, 60.36. So out of 60 million, just 1.7 million, I do not know how many have become infected and recovered. That would also be part of herd immunity. So France, you are correct that maybe it's the vaccination drive that is behind. So Jody says, my boyfriend just got back from Italy. He said the plane was packed. Yeah. UK is doing pretty good, although they are not letting people have ivermectin. Ruby Zaret says, Dr. Bean, Italy vaccines 5.951 to 9.86 doses per 100, 6.9% of population. But fully vaccinated is even lower. So Simple Garden says, where in Italy is this surge? Is this related to returning workers from China, or is this UK variant? Does China have any variants? I do not know exactly how within Italy this is happening. Bushes, I tried the Bloomberg vaccine tracker. I guess I have to give in and give them my email. So they say register. I protested because here we are for more than a year now, just doing it without asking anyone to to become this. And Bloomberg, I think that is why they are better businessmen. Uh, they would not let us see it without creating an account. So let me create an account. They just wanted my email and now they're going to bug me forever. So here, let's see. So once again, per capita, per 100, Israel is still ahead. Then is Seychelles, then is UAE, Maldives, UK. UK is doing great then, and then others. And now let's see. Italy. Where is Italy? Here. So Italy says 5.95 total doses administered, 9.86 per 100. I think that is what somebody had put here as well. 6.9 is what? Percent of population given one dose, 6.9%. And only 3% fully vaccinated. So that's not a lot. That's not a lot. Compare that to, for example, Israel. Where is Israel? Israel is not here. US, China, EU, India, UK, Israel. Here, 44% of the population. I do not know why Israel's cases have not gone down, but 44% of the population fully vaccinated. They're putting everyone to shame. US 9.9%, UK 1.9%. Just 1.9%? Even then, their cases are down. There is something more in UK then. Either the new variants are weaker, they are saying these are more lethal and more contagious, or people have become more careful. The vaccination is not a lot. I mean, if you think about it, Turkey is more vaccinated, Italy is more vaccinated, France is more vaccinated than UK. John says, message from Steve Manfred, UK improvement is combined effect of heavy lockdown. So that can make sense. Vaccination is not making sense. Yes, it's just 1.9%. That's not enough. Their single dose strategy, well, even with the single dose strategy, there is just one. Okay, so with single dose, 34%. And so that may be helpful. Although Israel is 44% and still not there. Single dose strategy may be useful, get a higher percentage covered quickly, maybe. So combining, agreed, social distancing, previous infections, the population that has already become immune, and single dose 34% coverage, that can be useful, yes. Is Turkey or France or Italy in that kind of thing? No. So 6.9% in Italy, France 6.4% with single dose. So as France said, yes, the remaining Europe looks behind. John, thank you very much. And Steve, thank you very much for this note. Janna says, open here in Florida and we're in green light, just saying. Got it. Barbie says, you are just promoting it to make some people rich. It's killing people, and take it at your own risk for a cold. I, Barbie, I hope you're not directing something to me. Um, what else is happening? Machiavelli says, we agreed that was the wrong strategy. I think there is a separate discussion going on. Mark says, single dose seems very useful indeed. Yes, in kind of creating a big coverage, yes. And I think that even this concept that as the time continues to pass, single doses result continues to improve, that is very interesting. I saw a question here. RT Teat Waffle says, is Dr. Fauci more dangerous than Dr. Seuss? Shouldn't we cancel him too? I always hit thumbs up. Well, thank you very much for the thumbs up. And the remaining part should be clear to all of us. Hayato says, I hope Dr. Bean sees this. Uh, Tell me, what should I see? Hayato, are you Japan? Or you are a different person? Sorry. Um, So Giladoni says, how protective one dose? They say not effective enough. No, so the data that they gave Pfizer folks, they said that after 90 days, the efficacy reaches more than 70%, which is decent, which is very good. Yeah, so maybe just like at some point Sweden was slightly different, maybe UK is doing something that is different and interesting and useful. Hayato says, do you happen to know the company Sun Pharma in India where I have purchased their ivermectin via internet? Hayato, are you selling them or you just telling everyone? So if you're just asking, do you happen to know? I do not. Um, I hope they are good. DDS says, Cool Bean Shahida has liver cancer. Please pray. I, um, I hope she recovers fully and soon. Hayato says, Japanese. Welcome, welcome. So, Hayato, are you not able to get it from Japan? So, of course, India has been sending out ivermectin. I am not sure what are the right um, verified companies from India. I myself am not from India, so I do not know. But there are many cool beans from UK who say that they go on a website and get it from India. So I would request cool beans who have gotten it from India to please put those links for Hayato. So Sun Pharma is no one pharma company of India, Sanjeev says. Not available in Japan. That is so sad as well. Michelle says, Israel is 100% vaccinated, yet it hasn't obliterated the virus. So when does J&J, with an increased vaccination or not obliterate, we need to continue to wear masks and stay socially distanced? Agreed. And that is what is interesting for me for Israel. Israel, one dose, 56%. Fully vaccinated 44%, and majority of those who are fully vaccinated are elderly or the people at a higher risk. Even then their cases are not going down the way I wanted to see them going down. Dorothy Hughes says, what is your thought now for recovered patients being able to get SARS-CoV-2 again and become contagious? My unvaccinated 94-year-old mother lives with me and my recovered brother visits her. So we have done this discussion that someone who has recovered can be contagious. The amount that they would shed will be lesser. But in the first 24 hours when they get it would be almost the same as others. And I'll give you an example. Let's say I have become ill and then I have recovered. In my mucous membranes, I have immunoglobulin A present now. And in addition to that, the cells here, the lymphatic system here has B cells, T cells, memory cells, and they know about the virus. So when the virus arrives in my mouth again or nose, one, the IgA present in the mucous membrane is going to bind with it and kind of make it less capable of entering the cells. And secondly, even if I now cough it out or laugh hard or something and it goes back, it's going to go back with the IgA on it. Within 24 hours, then, the remaining system will wake up, and innate arm and the adaptive arm both together would attack it. And then the contagiousness of the person will go down because virus would be tackled. So first 24 hours, slightly more, then low, but it should, in theory, never be similar to somebody who was not infected before and is contagious. It should not be that way. It should be lesser than that. But a person can be contagious. Fishtail says, how can we test for counterfeit ivermectin? So that is the problem. We cannot. That's the... And I'll tell you something funny. When the vaccines were coming out, and they were still in trials, somebody sent me a picture from one of the countries on the Asian side where there were fake vaccines, and they were tiny they were actually packaged things, tiny droplets or things that you can use. And they had said that use them in your mouth or nose with their drops. And they were named as Pfizer or AstraZeneca. So it's just so cruel of some humans to try to earn in this time by hurting others. So don't know how to tell exactly how to tell apart good ivermectin from bad. 1400 likes, make it 200 and Luffy will do his impression. Is it 1400 or 140? If it is 1400, these are lots of likes. If it is 140, then I am a little sad. Michelle says, are people who do not produce antibodies in response to COVID more at risk of more severe disease? I'm a long hauler and do not have antibodies. No, actually, it was seen that the people who respond through the cytotoxic pathway, they are better protected than through the antibody pathway. And interestingly, FDA has now approved a test that does the cytotoxic T cell measurement. So maybe, Michelle, you can get that test as well. It has just gotten approved. Fishtail says, I thought 5 weeks, one shot, 92.6. 5 weeks, one shot? No, I don't think so. Carlos, you're still waiting on Cancino. I've talked about Sinopharm, but not Cancino. Yes, I would do it. It always becomes a little trouble talking about these vaccines because the data is just so not present. Cancino. Giladoni says, I have a friend giving antibodies for a year now, meaning having. Is the T cell expensive? I don't know. I didn't go and see the price. I don't think it's going to be expensive. John Snyder says, so if I get Pfizer at room temperature from Etsy, it might be fake. Next, he'll be telling me my KN95 is fake. And something funny, my wife actually bought KN95 and she said, look, I got some new masks for us. And they were KN. And I said, look, they're KN. And she was so upset. Marie says, public libraries quarantine materials when they are returned by patrons. What happens to any coronavirus on these materials? How does a coronavirus become non-infectious with time? So very good question. We have done elaborate discussions on this in the past. Let me just explain it once more. It is actually an interesting question, and there have been so much discussion about it. So look, what happens is the following. There is something fortunate about coronavirus and us, and that is coronavirus has a membrane on it, which we say envelope. This is a lipid membrane. Inside this is definitely water. And then inside is the RNA. RNA is then covered by nucleocapsid proteins that kind of protect it, and then other things. And then in the membrane are M proteins, and there are spikes attached, and so on. This is the structure of the coronavirus. If coronavirus, just like us, we need moisture for our skin, otherwise it becomes dry and starts cracking up. If not cracking up in terms of laughing, but cracking. So it will be funny that the skin laughs. So here, imagine that the virus doesn't get enough water and its skin breaks. So I know that people are going to be upset that I'm using terms like skin with the virus. The envelope breaks. That broken envelope would cause the viral content or fluid from the virus to kind of go out, right? So it's just going to be spilling out of the virus, and now this virus is not viable. So then it's a very simple thing to figure out that what environment will make it not viable. Any environment that causes the vapors to, or the water to vaporize, will be not good. For example, very hot environment that causes the fluids to vaporize will make the virus invalid or unviable. Similarly, if we have a surface that is porous, for example, cardboard or paper, these porous surfaces, these will absorb the fluids from the virus. And because of that, the virus is going to shrink and become less viable very fast. And so these things are going to render it useless within 2-3 hours. On the other hand, if we have shiny surfaces, which means non-porous surfaces, for example, plastics or very decently polished metals, mostly plastics, and they're not porous at all, and they are beautiful, and these would be very good for the virus, because now they are not going to suck the water out of the virus. Similarly, a surface that already has moisture on it is going to be very good for the virus, because inside the moisture, or if the environment has more moisture as well, that's also going to give the virus some more viability, because it would not shrink and be destroyed fast. So I hope that answers that question. So Michelle says ultraviolet rays do not go 3D though. I read copper was a great. Copper is good. Ultraviolet rays can do the good work as well, but one has to make sure that our skin doesn't get burned. Next Wednesday, gold. Okay, so how about we break for today? So correct. So paper is cardboard, paper. These surfaces are bad for the virus. It gets shrunk because they would pull the fluids out of it. Just like if you make your hand wet and put it on a paper, just like paper napkins, they're going to pull the fluids out and then absorb them. That is the same thing that happens to the virus, and virus cannot sustain giving so much fluids. It's just going to become damaged, and once the envelope is broken, this virus is useless, because now it cannot bind the cells, it cannot enter them. The whole thing is just destroyed. It is unviable. Yes, Luffy's soap and water is bad as well. So anything that can emulsify the lipid. So of course the membrane, the envelope is made up of phospholipids. So soaps are bad for it. Alcohol is bad for it because they emulsify or they break down the lipids. There was a question from Doug. My vitamin K2 has alpha in it. Is that normal? Alpha. I do not know about that component. Let me see. Alfalfa. K200 with alfalfa. So what is alfalfa? 300 milligrams of alfalfa. So alfalfa. It's a vitamin mechanism action. Just one second. Saponins contained in alfalfa act on the cardiovascular nervous system. So these are saponins. Yeah, so not bad. If it is there, that is fine. Hey, Luffy. Steve says that is just a natural grain. Excellent. Margaret says, thank you, cool beans. Thank you very much. Margaret, to you as well. It's a legume, alfalfa plant. Cool. So, a type of grass. Thank you very much. Bruce says alfalfa green manure. Kelly says good night. So good night, Kelly. And I think we are about to break here as well. Hay for horses. Machiavelli. Cool. So I hope it was fun. Please do me a favor. Please like, subscribe, and share. And please, if you would like to support this work, there are 3 links in this description. One is to be my patron, one is to buy me coffees, and one is to just support this work. So thank you very much, and I would see you tomorrow.